Humphrey, our male cassowary, is a bit older now. He's considered a senior here. He's 33 years old, and he's experiencing some joint stiffness and a little bit of lameness, especially on his left side. So we've tried to medically manage it for a bit now, but it seems like that wasn't quite enough for him. So our wonderful vets at the University of Florida Veterinary Medicine department actually came over and were able to do a steroid injection into that joint to help get him some relief directly in the area that was causing him some pain. So the first step in the procedure was to shift him. We have a small shift area in the back where he can be safely sedated. So step 2, once the vets had assessed Humphrey, made sure that his vitals were looking good and that he was fully sedate and safe, our keepers came in and assisted our vets in picking him up and carrying him out of his enclosure and into our GOMEC building. It's actually the closest building we have to the cassowary habitat. And what we want to make sure of any time that we're working with cassowaries, especially with free contact, meaning there's nothing in between us and that animal, even if it's sedated, is we want to be as safe as possible. So transporting them across the zoo would have been a little bit more challenging and maybe not as safe. So using the GOMEC building meant we just had to be out in the public space for a few seconds. We were able to get him into an enclosed space where he would be safe. We could monitor his vitals inside of a climate-controlled area that they could make sure, he was warm enough, he was under direct lighting so that they could see really well, and he was out of the public area. There are different ways to anesthetize animals, and when they're going under for a major procedure, they will be intubated, meaning there's a tube that's going to go down his throat. So that's what they did first. It made sure all of the anesthesia was set up and he was stable, his heart rate was stable, his breathing was stable while he was under anesthesia before they started anything with his joints at all.
There was some like in here.
Dr. Adam is a large animal vet at UF Medical School, or at the veterinary school. And he has a specialty mostly in horses, but actually the joints are somewhat similar. So he came in as a special trip to evaluate Humphrey because his legs and joints are going to be somewhat similar. And he does those injections more often. So he came over, did a full range of motion on both legs just to see how far Humphrey can move, if there's any crepitus or pretty much like crunchy arthritic feelings in those legs. So he could ascertain exactly where that discomfort was happening, because when we do the joint injection, we want to make sure it's to the joint that's causing him difficulty. I am not the veterinarian, but just kind of layman's terms of what happened. Actually, Humphrey went to UF a few years ago and got a CT scan of his entire body. And they were able to use that CT scan to create a 3D printed bone. And they actually use this to kind of map out where that injection was going to go in. So they have to make sure that the injection of the steroid goes into the joint space. So they can't just blindly stick it. So they use this to kind of map out exactly where that bone and the joint were. And then they also used an ultrasound, a portable ultrasound, to get a better look inside.
If not, we need another battery.
And then once they were sure about where everything was, they use that really long needle to get directly into that joint space. I think as a zookeeper, you think that people get used to it, but it is really awesome, even for us that see these animals every day, to be up close, to actually touch them, to be able to touch those claws and their casts. Because normally we really don't get that chance, right? Because we work protected contact, meaning there's always something in between us and those animals whenever we're working them. So we actually get a really good look at these animals that we take care of every day. We get to know them a little bit better. So when they're under anesthesia, obviously we're excited that they're getting this awesome treatment that's going to help them live a more comfortable and a better life. But we're also really excited just to be able to get up close and see that animal in a way we don't normally. It's been about 2 weeks since his procedure, and it usually takes about 1 to 2 months for this injection to really take effect, but we're already seeing great improvements in his gait. So he's walking almost normally now. So he looks like he's years younger than he actually is. So if you want to come see Humphrey, definitely recommend checking him out over by the Gomek building. We also have a behind the scenes tour that checks out both of our cassowaries, and you get to learn a whole lot more about them personally with our education staff. So definitely come check them out.